Do you know when we're broadcasting, Anthony? Or shall I?
You're broadcasting now.
Okay.
Someone, yeah.
So welcome everybody to the Nightingale Challenge Global Partnership session. My name's Harry Mandar and I am the Strategic and Operations Advisor for the Nightingale Challenge. Unfortunately, I haven't done most of the work. Most of the work has been done by Matt Daly, who unfortunately can't be with us today. But he will watch this live recording. So thanks, Matt. And we can all connect with him afterwards. So today we're going to be talking about how the Nightingale Challenge is aiming to connect organisations around the world. One of the key core goals of the Nightingale Challenge is to amplify the voice of nurses. And part of the way to do that is to increase confidence through connection and shared experiences, and also passing on learnings from different sites, communities and cultures. It's a ground-up, bottom-up operation, therefore there is no one-size-fits-all, but the opportunity to have partnerships where we can extend activities and lessons that we may have learnt and see if they resonate with other cultures and communities is important. But it is important also not to assume that one format is the best, which is why we should have these partnerships to communicate. So we have been setting up, I'm going to share my screen now. So we've been setting up initiatives since 2019 when the Nightingale Challenge was set up. As you know, today is the anniversary of the Nightingale Challenge. So today we have the opportunity to connect through the meetup room and networking area, in which we can connect you with other organisations in which you can partner with. And what we'll do is see what types of activities or partnerships and connections you're interested in, and as the Nightingale Challenge work with you to try and find the optimal partnerships for yourself. Today what we'll be doing is talking through a current partnership with Jeremiah and Debbie. So Jeremiah Maynor from Kenya, who's the CEO of the Clinical Nursing Society, and Debbie Cromack from Bradford NHS, who's the manager of the Learning, Education and Nursing Department. And they'll go through an existing partnership and their experiences of that. And then we'll move on to Rasheen, who will talk through her country experience working with Cambodia and how her experiences of setting up and managing a country partnership. And then we have Ben Sims from the Tropical Health and Education Trust, THET, and he'll talk through the strategic view of the benefit and value of these partnerships. And then we'll have the opportunity to go for any questions, and also we can make use of the chat room. So in terms of the Nightingale Challenge itself, over 12 months, 84 organisations applied for matching, and I believe we have 40 partnerships at the moment. Due to COVID, there were some delays in activities because obviously all hands were on deck to conduct existing clinical activities. Therefore, the opportunity for the discussions and partnership discussions was delayed, but we're hoping that making use of some of the learnings from COVID, we can help support some of those partnerships in the most efficient and non-intrusive way to share and continue partnerships for benefit, not to have the partnership. And then also we're looking to increase and have more partnerships going forward. At the moment we have 33 countries, and these are just some of the partnerships by country. So we've got countries ranging from New Zealand to Sierra Leone and Pakistan, and the connections we've noticed can be either with similar culturally or geographically, but also completely different. And there's no limit to the number of partnerships that we hope different organisations can have. So if I could move on now to Jeremiah Mayna and Debbie Cromack, to talk through your experience and activities of an existing partnership between Bradford and Kenya, and what you've benefited from it, and lessons or tips you might have for other interested parties who are interested in considering partnerships. That would be great. So if I could hand over to you, Jeremiah and Debbie, that would be great.
Okay, do you want me to go first, Jeremiah? We haven't got an order, have we? So from my perspective, the partnership with Kenya is really exciting. It has been impacted, obviously, by COVID. So we really want to kind of reignite that and kind of reset from July. But we had some quite exciting plans in our year-long programme that haven't come to fruition, but we're obviously, with the extension now, we can put those into practice moving forward. One of the things that we wanted to do was a collaborative art exhibition event, which would have been held in May this year as part of International Year of the Nurse and Midwife. So the theme of that event was going to be nursing in 2020 through the eyes of a nurse. So we wanted it to be an art exhibition, so it could be around ceramics, textiles, photographs, paintings, a whole range of things coming from our young nurses. And what we aimed to do was, Jeremiah had some examples from his young nurses. So he was going to choose, I think, about 5 from his country, and then we would choose 5 from ours. We would exchange them, but still hold the art exhibition in our respective countries. So like I say, that unfortunately had to go on hold this year, but certainly from my perspective, I think we can certainly go ahead with it in terms of International Nurses Day next year, so hold it in May 2021. What we've also done is exchange emails of the Nightingale Challenge nurses in our respective countries. So to almost go back to what I used to do when I was young and at school, you had your pen pal from a different country, and you went back to writing letters to each other. And what an exciting and very interesting time now to be doing that, in terms of understanding the experiences of our young nurses and how they've actually worked through and still are in that pandemic phase. Opportunities to share best practice. We've had opportunities to share each other's roles, so understand a bit more about what Jeremiah does, a bit more about what I do, and around nurse education as well. How is that different, or how is that similar in our respective countries? So lots of ongoing opportunities to continue to share best practice, and also just to kind of cement that relationship, really. So we've got some T-shirts that I'm still trying to send you, Jeremiah. Nightingale Challenge T-shirts and pin badges. Slight issue with the post office in the UK at the moment, but I will get those to you. So it's lovely in terms of cementing that relationship, to see pictures of our Nightingale nurses wearing our T-shirts, and certainly Jeremiah's in his country wearing theirs as well. I don't know if Jeremiah is there to give his perspective.
It seems like Jeremiah isn't currently here. I'm not sure where Harry's gone either, for that matter. Okay. In which case, shall we move on to Roisin? If you want us, do you want to talk about the work at Guys and St Thomas's? And hopefully Jeremiah will join shortly.
Yes. Hi. Hello.
Hi.
Yes.
Hi. Thanks.
You too. So hi, I'm Rachel from Guys and St Thomas's, London. So we have had a couple of introductions through the global partnership. We've been introduced to Jo May from Australia and Virya from Cambodia. I see Jeremiah has just returned. Shall I pause? Because it might be nice for him to continue where Debbie left off.
Sure, yeah, that would be great. Hi, Jeremiah. So Debbie gave an introduction on your partnership together, and if you wanted to talk to that now as well, that would be great.
Thanks, and thanks everyone. I'm sorry that I had a small hitch. Yes, I'm Jeremiah, and I come from Kenya Clinical Nursing Society. And yes, we have a partnership with Debbie. And this is in terms of our Nightingale Challenge. We are mentoring 20 young nurses. And we are doing a lot of, in terms of partnership. One of the activities that we wanted to do is a nut exhibition. Unfortunately, COVID came, but the young nurses are still in it and would like to continue. I think I'll get from there, then we can be able to move forward.
That's great. Thanks very much, Jeremiah. Alrighty. In which case, Roisin, do you want to take over?
Yes. Hi. Thanks, Jeremiah. Thank you, Anthony. Roisin Fitzsimons from Guy's and St Thomas's. So we had a couple of partnerships with Jo Mapes from Australia and Virya from Cambodia, and partnerships in two very different ways. So Jo was originally from the UK herself and reached out to see if we could provide some sort of partnerships, because it's very common that we have lots of young nurses from Australia who have come over to England to travel and get experience of working in the UK. And similarly, many UK nurses go over to Australia and work there and have experience travelling working in Australia. So we wanted to see if we could maybe have some sort of exchange programme or link in that way or other. Jo visited us back in February this year, just before everything sort of was put on hold with COVID, as I'm sure many places across the world experienced as well. But we were able to share some information. We were both doing some work around advanced practice and also well-being, looking at the HALT campaign. And so we were able to share some policies, some guidelines that we had created and Jo had created around advanced practice. So we were able to share that, and we're still in email contact, we're still in communication, and we're supporting each other through putting our leadership programs on hold whilst we weather the storm with COVID, and then talking about how we get those back up and running and how we can continue to provide peer support and mentorship for each other moving forward. The relationship with Cambodia has been quite exciting and quite challenging as well. So we started speaking with Virya earlier on. So he is the Chief Nursing Officer for Cambodia. And we started speaking with him and Matt Daly, who is the Fellow at Nursing Now, who is leading the global partnerships. We started speaking with him, it was before Christmas actually, to try and see if we could collaborate and co-create a leadership programme for nurses and midwives in Cambodia. And we very much wanted it to be drawn from the leadership programme that we are running at Guy's and St Thomas's, but relevant to nursing midwifery in Cambodia, and also providing some sort of mentorship as well. I think there's some real richness and learning that that everybody who participates will be able to gain from sharing of experiences and understanding what nursing is like in different countries. And similar to what Debbie was saying, I remember back in the days of pen pals as well, and this is something that we discussed as well, how those nurses within Guy's and St Thomas's who are participating in the Nightingale Challenge can link with nurses and midwives in Cambodia who are undertaking their leadership development programme as well. And we talked about using virtual platforms to share, so to discuss particular practice issues and how they relate to nursing in the UK and nursing in Cambodia, and to look at commonalities, so the similarities, but also the differences and how challenges might be approached in different ways. But this was put on hold due to COVID, so we are just hoping to pick up the conversations. But I think for me, the learning has been incredible, sort of talking to Viria in Cambodia and hearing about how nursing is very different over there in terms of training, but also practice as well. And just simply thinking about how we could use virtual platforms to collaborate across continents is been quite challenging, but something that in light of COVID is new learning for all of us. So I'm really sort of looking forward to embracing that challenge moving forward. Thank you very much.
That's great, Roisin, thank you. And I think yeah, making use of these virtual platforms, it's great in a way that we're in this position because people are making much better use of them. And on your point about specific practice issues, one of
Harry, I can't hear you. I'm not sure if you've got mute on or if it's my sound.
I can hear you.
Oh, it's me then.
Sorry. Can you hear me now, Roisin?
Let me refresh and see if it makes a difference.
Okay.
Debbie, are you able to hear Harry?
Hi, yes, I can hear. Yeah.
Okay. Great.
So one of the things that I was going to mention whilst Roisin is getting back in is part of the Nightingale Challenge. One of the new initiatives that we're actually launching today is the Global Solutions Initiative, where nurses and employers can connect around the world on specific issues in order to innovate and discuss how they may have addressed certain issues. And what we're going to be doing is running a competition to the end of the year in which collaborations can talk about or present findings of specific issues they've had to deal with, how they've addressed them, and how lessons they've learnt may be able to benefit other organisations, and how in partnerships they've developed those learnings better or further. So I think Roisin's still logging in, but if perhaps... Oh, hi, Roisin. Did you hear about the Global Solutions Initiative?
Yes, I did, yes.
That's great. So we'll, you're obviously a great champion of the Nightingale Challenge, and it would be great to involve you and your teams on that as well. Going forward, we'll be, I think, well, we're launching it today, and by the end of the year, we're hoping to have some winners, or at least 5 winners that can participate and attend next year's event. Hopefully, we'll be able to have some live event that actually meet people face to face, not too close. So if perhaps we could just move on now to Ben Sims, who is the CEO of THET, which is Tropical Health and Education Trust. Ben, would you like to give us an overview of your perspective on the need for these strategic partnerships and the value and benefits for now and the future? I think you might be on mute, Ben.
I do apologise.
That's all right.
Harry, thank you so much for inviting me to speak. Apart from anything else, it gives me the opportunity to register THET's support and admiration for what is being achieved by Nursing Now. So we think it's transformational and are passionately committed to supporting this agenda. And we were there at the beginning, but I think we're becoming more and more useful to you, and certainly will become more useful in the future as we look to consolidate what Nursing Now has achieved. And some of that is, of course, the wonderful reports that are produced, the state of the world nursing, but the gender analysis that you've done, etc. And THET is really embracing that learning and that analysis to try and influence our behaviour going forward. Now, you may know, some of you, that THET is well known for the health partnership approach, which from a UK perspective is about linking institutions, health institutions in the UK with their counterparts overseas. And this has been around for a long time, and particularly championed by Lord Crisp and by our founder, Professor Sir Eldred Parry. And the wonderful thing about these partnerships, I think, at their core, is that these are links that are entered voluntarily, which bring together peers in the manner that you are encouraging in Nursing Now and through the Nightingale Challenge. And I think there is something magical about the solidarity that can be expressed across borders between people facing similar challenges from similar backgrounds. And that's really what enthuses THET. We've been a long-standing champion. It's also worth saying that the UK government has been a very good, long-standing champion of health partnerships between the UK and overseas. Since 2009, significant funding has been provided by DFID, and more recently also by the Department of Health and Social Care, recognising the mutual value of this. So it's very much about, yes, the UK trying to contribute to the development of health systems and individuals overseas, but have no doubt there is a benefit for the UK in this. So we document very actively, alongside others, the kind of benefits that individuals who take part in these schemes derive from this. And we've also begun more recently with, for example, Gates and Health Education England funding to look at capturing reverse innovation and how we can learn in the UK from people who often achieve more with less because they're operating in very low resource settings. And I think perhaps it's particularly appropriate for me to acknowledge how much the UK can benefit from our contact with partners in Africa and Asia at this time, when we see the UK really struggling to respond effectively to COVID. And it's a time for humility on our part and for recognition that we have so much to learn. And health partnerships are really a fantastic vehicle for that kind of, to use the jargon, bi-directional learning. And I think those of you who are involved in the Nursing Now and the Nightingale Challenge, you must be feeling similarly the rewards flowing both directions. If I talk about some examples, I'm sorry I don't have slides, but I've been dropping links into the chat box. I hope it's the right place, but on our website you'll find a sense of the scale of this. So our 2011-2019 impact report, for example, shows the story across 130 such partnerships between UK institutions and institutions overseas. And it gives a flavour of the kind of contact that has happened in that. I have to say, nursing has been always a preeminent feature of this, because apart from anything else, it is the nurses in most of those low resource settings who are doing the bulk of the work, with all due respect to the medics in the room. And so the lion's share of funding actually has gone to support nursing training or nurse-led interventions. One project I particularly am fond of is the University of Edinburgh twinning with partners in Uganda, looking at fostering nurse leadership in palliative care. And I like that for a whole load of reasons, but one is the word leadership in association with nursing and the recognition that actually if you're going to progress palliative care in Uganda, you really need to be working with nurses. But the second reason I like it is really because of that palliative care dimension. Palliative care, as we know, is not something that people generally tend to prioritize. And so it was particularly pleasing that that program was supported. Going forward, FET continues to have funding and continues to support this approach. And I wanted really people to be aware of it so that they could think about how they might get involved in existing health partnerships and how relationships that might exist between individuals can actually be enhanced even further through involvement in health partnerships. And if I may say quickly for context, it's not just THET and it's not just the UK. Health partnerships is an approach that's recognised at WHO level, and the WHO have a Twinning Partnerships for Improvement programme, which THET contributes to. But THET is also a member of the ESTER Alliance. So if you're in Germany, France, Switzerland, Ireland, for example, you will also find equivalent kind of approaches going on. And I think there is something about the joining with existing initiatives which can amplify the influence you have as an individual, or amplify the impact of the project that you might be running, but also give you a chance to access funds. You may know that the UK is a very odd position with regard to DFID and the Foreign Office, and we're going through a merger of the departments in the UK, and that has slightly meant that I'm not able to announce as clearly as I'd like to what some of the opportunities going forward are. But suffice to say that I feel confident that the new department will be supporting this approach going forward. It's, apart from anything else, sharing the expertise of the NHS, sharing the expertise of the oldest health service in the world, delivering universal health coverage for its citizens free at the point of use. Apart from anything else, this is the best of Britain. And I think that resonates very strongly with the current government. And so I think if you can go to the THET website, sign up to our newsletter, you will notice all sorts of funding opportunities emerging. And I would really, really like nurses to be involved, as would the government. So at the launch of Nursing Now, very excitingly, the DFID minister who was present committed to spending at least £5 million on nurse-led initiatives in the context of health partnerships. Now, we think actually it may be more than that because nursing is so important, but it's certainly a minimum that we can expect to see in the future funding stream. So please do check it out and get engaged. There are a couple of final things I want to say. One is, if I may, by the way, partnerships have flourished during COVID. So it's interesting to hear colleagues speak, but one of the things we're documenting is just how brilliantly these relationships have survived the pressure of COVID. And it's become about solidarity, about sharing lived experience on the front line. It's about thinking about how we can offer practical assistance to support the physical safety and the mental well-being of health workers on the front line. And, you know, initially when the pandemic hit Britain, and people said to me, well, what's happening with health partnerships? I said, well, you must be mad. Nothing's happening with health partnerships. We're all consumed by the pandemic. And what's happening in the UK? We have no energy to look out beyond our own shores. And I was completely wrong. I started getting messages and started getting texts. And within a week, I'd done a U-turn, which was, slightly embarrassing. But I've absolutely, totally changed my view because I became aware that these ties of relationship, professional friendship, are so strong that they've survived. And it has, as you were saying, Harry, earlier, it has, and as Roisin was saying, it has led to a revolution in our use of technology. And one of the things I'm really excited about is that THET is creating a digital platform, which will be a platform on which to exchange learning and information so that we can build the evidence base of how health partnerships are contributing to health systems, both in Africa and Asia, but also in the UK. But also we'll be employing a digital engagement officer to make sure that platform's well supported. And when I talk about these things, by the way, please know that these resources that everyone can access, these are there to be of use to you to help your partnerships flourish. One of the examples of a partnership flourishing under the circumstances of COVID is the Birmingham City University Lusaka College of Nursing. And I've given you in the chat box a link to a blog by them in our recent newsletter. But I will conclude there just by saying, you know, I salute the nurses who get involved in these programs. And I salute Nursing Now. It's an absolutely fantastic initiative, and FET really is thinking very carefully and very much open to influence about how we can help secure the important legacy of Nursing Now going forward. Thank you.
Great. Thank you, Ben. And I think your discussion about the sort of interrelated and interconnected world that we live in. So we have to be more connected to everybody around the world. Excuse me. I know we're not physically able to connect, but soon we will be. And all of those things in terms of environmental, clinical, business, commercial, they all interconnect with how we behave. So I look forward to the digital platform and looking at the newsletter, which I'm afraid I'm not signed up to, but I will sign up to. Roisin, did you have anything to add to that?
While Roisin joins us, so front page, FET website, bottom, sign up to newsletter. GDPR means I can't do it for you. But yeah, please do sign up.
That sounds great. And I love the humility of learning from places and organizations where there is no funding or there is no money, and you have to be innovative, and you do try because you don't have this great support behind you, or sometimes bureaucratic process behind you, and you have to be creative. And I think learning from processes which have benefited because of bureaucracy, but then also learning when you haven't had them, is why we should be connecting much more as well.
And what Nigel Crisp helped us do last year was to look at this with Imperial College colleagues and look at the unconscious bias in this.
Yeah.
So there is an agenda here which is really interesting, which is why is the global north less inclined to learn in this way? I mean, Lord Crisp has been making this point for a while, as has Sham Syed at, you know, WHO level, etc. But why is it? What is it about the unconscious bias that prevents us from learning more openly about the innovations and approaches that have been taken in low-resource countries? So it's a big topic which we touch on also on our website, and others have. But you know, that unconscious bias, that, you know, which in the context of Black Lives Matters, I think has come alive really as something that we really know we need to address. Which, you know, talks about power relations, etc. That's the kind of agenda that I think is so fascinating in these partnerships. Certainly when you're looking at uptake and impact at a system level.
Yeah, perhaps with the future partnerships, the next batch of partnerships that we're looking to develop, we could involve that in how we sort of make use of some of those to not address challenges, but to learn from them so that we can address them in the future, because there are some systemic structural changes, but we can only understand them through listening to these partnerships, which we'd be happy to sort of connect with. And
I'd love to. So we've learned from you a bit around the gender equality agenda, especially that wonderful report the Nursing Now produced, but I'd love to share notes because there's a broader analysis of power and inequality that is influencing our behavior and our learning. So I'd love to compare notes. Yes, please.
Great. Debbie, Jeremiah, Roisin, do any of you have any further comments on your learnings for the partnerships, or something that you think other partnerships or organisations could benefit from or pin to what kind of things they should be requesting when they're looking into partnerships? Because one of the things we ask is of new organisations, what is it you're looking for? And it's quite a big ask. So do you have any tips of what kind of things that you've learnt from or that they could be requesting? Maybe if I start with you, Roisin.
Yeah, so I think it's about being specific about what it, as you say, what it is that you would want from a partnership. I found with the partnership with Cambodia, we spent a lot of time trying to understand how we could work together and what exactly the what exactly it is that we could provide in terms of us from Guy's and St Thomas's, how that would be of benefit to Cambodia. I think I didn't understand. I had to do a bit of reading and had some conversations with people that understood what nursing was like in Cambodia. So for me, I had a lot of learning to understand, because it's difficult. You can't just pluck a ready-made leadership program from one organisation to the next in one country. There's different nuances around processes and bureaucracy, as you mentioned, whereas in a completely different country, it's a different culture where nursing is very different. There's going to be different challenges and very different issues as well. So it took a lot of time for me to understand the needs, but also for trying to really drill it down as well, because in Cambodia it was something for the entire country. What we had already and successfully been running for a few years was something for one organisation. So there was quite a lot of disparity, and it's trying to work out how we met in the middle. So there was a lot of conversations. So I think the learning was we really had to get used to virtual technology. So Zoom became our best friend, and we did a lot of very early morning phone calls, and I think Verview was sort of later in the afternoon, where he'd had a whole day's work underway. So, but it was good. It was just learning to listen to the other, to the partner, and see how you can work together. And I think that's what it is. It's about, I suppose, in a nutshell, managing expectations, maybe your own as well as other people's as well.
Yeah, and I think perhaps when we do ask, maybe we could be less specific, because obviously you have the first few meetings where you are just sounding each other out and working out where you both fit and where you might fit. So perhaps if we maybe need to adopt a slightly different approach, and maybe there is the specificity if you know it, but if you don't, perhaps it is that, okay, being open to what you might be able to learn. Thank you, Roisin. Jeremiah, do you have any points or tips on what you think other partnerships could, or people considering partnerships may consider, and in the value that you've gained from your partnership?
Yes, I think also in terms of moving away from nursing and informing nursing, like what we're doing in terms of art exhibition. Most of the time we are with the patient, and maybe we just communicate with the sick, but we have the health community who does not know what nursing is. And when I talked with the younger nurses, I found they are very innovative. We have one who have done a good poetry on cancer, and it takes you through in a very, very nice way that even someone else would appreciate to see the process of what is cancer, how can you communicate. So I believe that there are those different skills that nurses have that most of the time at the bedside we don't exhibit. So thinking through on which other way can we communicate to the public. And this one moves in around with issues of nursing the world, moving from healthcare to health. How are we going to the community, and which language are we going to talk to our community? Because we must get to the language that they do understand. We have the younger generation, they like music. We have to put our nursing into music. They want poetry, they want art, and I believe that is what I have learned with Debbie, and in terms of whether it is walking, maybe in terms of prevention and promotion. And most so we have difference, maybe like in our country where we have younger generation who are unemployed. We have many nurses who are not employed, and the government cannot be able to employ. How are we going to build their skills? Maybe they might get professional income. And we are looking at this space where the other people, maybe the artists, are getting a lot of money and such. So I think, yes, what I've learned is that there is quite, I would say, quite a lot of things, a lot of opportunity. And what COVID has brought is more innovation, use of telemedicine, We are looking at now home-based care becoming an integral part. So I'm seeing that moving forward, we might be able to build skills, and nurses are going to get more in terms of professional feedback rather than getting employed. So I think, and moving forward, what we are looking at is how do we build this capacity? How do they become the way the lawyers open their clinics and move on, open their offices and move on, so that they don't pressure the government in terms of seeking for employment that is not coming by. How do we also have this mentorship? Because that is another thing that I've seen that is really beneficial. I have a young president that I'm mentoring, and what I've gained from her, I thought I'm a mentor, but I'll find that the young generation, and I think we had this discussion earlier, Minding the Gap, they have a lot to give to us. And I think, to me, that is something, the greatest gap that we had in nursing, where everybody was looking at the older generation as the cause of the problem, the nursing profession. But I'm finding that once with the mentorship, then you bridge that gap and you are coming to an understanding that the real centerpiece is your client. So I'm seeing a lot in Nightingale Challenge that we can benefit and influence the health, because I think once we change the community perspective in terms of how they view us, in terms of how they feel the disease, how they seek their healthcare, and I believe what our read has said, and I think this is what health is made at home and hospital is for repair. So then, why would you want to be mechanics? We need to also go. Thank you. Yes, we need to. We don't want to be called the mechanics. We want to stay with health people. We need to talk with them. We need to joke with them. We need to look at the environment. One of the things that COVID has taught us in our country is that due to hard hygiene, we have a reduction in diarrheal diseases. And it is a very sort of positive impact. So I believe that there are behavioral changes that we can do. And I believe in this partnership, we are going to have a lot in terms of inspiring the next generation, not only to look at employment, but look at the skills that they have gained and influence the society. Thank you.
That's great, Jeremiah. And I think your point about learning from the younger generation as well as the older generation means that you will connect better with the community. And it is right, we do have something to learn from everybody. And it's brilliant that you see things that way. That's really heartwarming. So perhaps, Debbie, I could ask you to have almost the last 5 minutes, if you would like to talk about your experiences and how you think other organisations might benefit, or tips and tricks for them.
Yeah. Sorry, I've got some technical issues, so I don't know what's going on with my video, but that might be a bonus that you can't see me. I think it's really interesting what Jeremiah said in terms of mentoring, because I think we've got real opportunities with these global partnerships to support each other. So even, we've talked about pen pals and the Nightingale Challenge nurses themselves linking and learning from each other, but maybe there's some opportunity for the Nightingale Challenge champions to even provide some cross-country mentoring opportunities. I think that would be quite interesting to explore. I know I've shared our preceptorship handbook with Jeremiah. I don't know if it's got to you yet, Jeremiah, but it was posted hand on heart. And that's very interesting in terms of our discussions, because obviously from communicating with Jeremiah, preceptorship doesn't happen for his nurses. So is there anything that we do deliver in terms of our programs that can be shared with Jeremiah and vice versa? And definitely when you've spoken, Jeremiah, about home-based care, that's basically what my trust is now delivering. So a lot of our community services now, have gone a lot more home-based because they've had to, because of the impact of the pandemic. So lots of opportunities to share, I think, and learn from each other. And I think kind of looking at this a little bit broader in terms of all the work that the Nightingale Challenge supporting organisations are doing, we're having a lot more workshops and things like that on these types of platforms that, we've got a potential to record some of these and then open them up and share them, across the countries, across the globe. There's lots of topics that would transfer across the different areas. So yeah, I think it's an exciting time, and I think it's bringing a lot of opportunities and a lot of new discussion to the table. So I would urge those that are part of this topic this afternoon to, if you're not part of the Nightingale Challenge, I would urge you to do that and to really look at the bonuses and the benefits of engaging in a global partnership.
It sounds great, Debbie. Thank you. And I think you're right. As you know, Wi-Fi and the internet is intermittent around the world, and being able to share like summary points or short recordings of these things means that people can hopefully download and listen to them anywhere. And I think sharing all of these experiences from the current, the partnership level that you've had with Jeremiah, and then the country, and then the strategic benefits, it's learnings for everybody, I think, and it's really inspiring to see how hard these partnerships have, the effort that is needed in these partnerships, but also the benefits from them. So thank you all so much for taking the time to share your experiences today. I think if we have any specific questions, we can answer those. I think we had a couple of questions about how to set up partnerships, and just reach out to us at the Nightingale Challenge. I'll put my email address in here as well, in the chat box. But we will help you find partnerships and help you connect. And as we said, it can be very specific, or it can be a bit broader. So we'll work through those with you, and looking at the opportunities from clinical activities all the way through to art and community-based, which will really address the whole system of healthcare, or health, not just healthcare, is really what these partnerships are for. And yeah, if there's anything else that anyone would like to add, please let me know through the chat. But otherwise, thank you so much, Debbie, Jeremiah, Roisin, and Ben. Really great to hear from you all. And yeah, this recording will be available, and we'll be all in touch. Thank you very much. And thank you, Anthony.
Thanks very much.
Thank you, everyone.
Thanks, everyone.
Thank you, everyone.
Thank you.